Hello everyone, my name is Zainab and I'm a nursing assistant. In this video, I'm going to demonstrate how to perform proper perineal care.
Upon entering the patient's room, introduce yourself and clearly explain the procedure. Knock firmly on the door before entering to respect the patient's private space. Introduce yourself. Pause briefly for permission. Perform hand hygiene immediately. And wear gloves. For security and patient verification, always ask the patient for their full name and date of birth. Following verbal confirmation, check the patient's ID wristband to verify their identity. Prior to beginning the procedure, get a clean water and ensure it is warm and comfortable, ideally under 115 degrees Fahrenheit, 46 degrees Celsius. However, always ask the patient for their preferred temperature. Doff the contaminated gloves and perform hand hygiene. Don a clean pair before starting the next step of the procedure. Always obtain informed consent before starting the procedure. This means asking the patient for permission before touching them. Before beginning care, adjust the bed to waist to hip height and lower the head of the bed to ensure proper ergonomics and protect your back from injury. Flatten the head of the bed and lower the corresponding side rails. Carefully fold down the top linens to maintain optimal visibility while exposing only the necessary areas of the body. Clear communication is essential. Always explain each step to the patient before proceeding. Assist the patient into a side-lying position by supporting their right shoulder and hip, gently rolling them toward the opposite side rail, and instructing them to hold on to it for stability. Once the patient is in a side-lying position, fold the Macintosh halfway and place a clean, rolled towel alongside it. Raise the side rails securely before moving to the opposite side of the bed. Return the patient to a supine position, letting them know beforehand that they will feel a large bulge under their back from the rolled towel. Next, lower the side rails and ease the patient into a side-lying position to remove and discard the Macintosh. Smooth out the underlying towel before returning to your original working position. Reposition the patient into the supine position and lower the corresponding side rail. Verbally advise the patient before adjusting the gown, ensuring bodily exposure is limited strictly to the required clinical zone to maintain optimal dignity. Use wet wipes for the primary cleaning of the area and properly dispose of the diaper. The proper stroke for female perineal care is always a single, gentle motion from front to back, anterior to posterior. Seal the soiled diaper in a plastic bag to prevent the spread of infection and lock in biohazardous odors. For a paralyzed patient, turn them into a side-lying position to remove the diaper. However, if the patient is mobile, ask them to lift their hips to assist with removing the diaper from underneath. Position the patient supine with legs flexed in a dorsal recumbent posture. The wiping protocol front to back. The golden rule is to always wipe from front to back, cleanest to dirtiest, using a fresh, clean section of a soapy washcloth for every single stroke. Never use a back and forth scrubbing motion. Initially, dampen the washcloth with water and wring it out completely. The center, wipe straight down the middle directly over the urethral and vaginal openings, moving from front to back. Change to a clean section of the washcloth. The near side, wipe down the outer fold closest to you, moving from front to back. Change to a clean section of the washcloth. The far side, gently separate the labia majora outer skin folds with your non-dominant gloved hand. With your other hand, wipe down the outer fold furthest from you, moving in a single stroke from front to back. Change to a clean section of the washcloth. Then, using the last clean section of the cloth, wipe straight down the middle to the anus. Apply feminine liquid soap to the second washcloth, rub it gently to create a lather, and use the same wiping strokes. Then, rinse the area. Simply dampen the washcloth with water and use the same wiping strokes. Use a clean, dry towel to pat the area dry, repeating the exact front to back motion. Straighten the legs, then place the patient in a side-lying position to clean their back. Support their right shoulder and hip while turning them into a side-lying position. Instruct them to hold the side rail for stability while ensuring their top leg remains flexed and resting on the bed. To perform this technique correctly, use the 4-quadrant fold method with your washcloth. Wipe from the vagina, scrotum backward toward the anus. Never wipe from the anus forward. Using the second section of the washcloth, wipe backward from the vagina or scrotum along the left side. And for the third section of the washcloth, wipe backward from the vagina or scrotum along the right side. Lastly, wipe the center from the vagina, scrotum backward toward the anus. Apply feminine liquid soap to the second washcloth, rub it gently to create a lather, and use the same wiping strokes. Then, rinse the area. Simply dampen the washcloth with water and use the same wiping strokes. Use a clean, dry towel to pat the area dry, including the legs. Perineal care for a male patient. The penis and scrotum protocol. Foreskin management, if uncircumcised, gently retract the foreskin to expose the head glands of the penis. Wash the glands, use a clean section of the cloth to wash the tip of the penis. Start at the urethral, opening the tip, and wash in a circular motion outward away from the opening. Reposition the foreskin, crucial safety step. Immediately return the retracted foreskin back to its natural, unretracted position over the head of the penis. Leaving it retracted can cut off blood flow and cause dangerous swelling. Wash the shaft. Use a clean section of the cloth to wash down the shaft of the penis, using downward strokes toward the base and thighs. Wash the scrotum. Lift the penis gently to wash the front and sides of the scrotum. Ensure you carefully clean the underlying skin folds, where moisture and bacteria collect. Dispense a small amount of liquid cleanser onto the next washcloth, rub the fabric together to generate a lather, and repeat the identical cleansing strokes. To rinse, wet another washcloth with plain water and squeeze it out. Use the same single-stroke technique to clear away all soap residue. Pat the area completely dry with a clean towel. Secure the opposite side rail and assist the patient into a side-lying position, turning away from you. Anal cleansing, lift the upper buttock cheek. Using a clean washcloth, wipe backward from the scrotum toward the anus, always clean to dirty. Wash the left side, right side, and center, using a fresh section of the cloth for each stroke. Rinse, dry, and inspect. Rinse the anal region completely and pat dry. Take this moment to inspect the coccyx, tailbone, and buttocks for any redness, rashes, or signs of pressure ulcers. Pat the area completely dry with a clean towel. Fold the underlying towel in half. Subsequently, introduce a clean Macintosh, folding it halfway to optimize the bed surface, and position a fresh diaper prior to returning the patient to a supine position. Raise the side rails securely for the patient's safety. Then, move to the opposite side to remove the soiled towel and smooth out the Macintosh. To apply the diaper, ensure the back tabs are at the rear and aligned with the patient's lower back and hip bone area. Tuck the front half of the diaper gently between the patient's thighs. For the tuck and roll technique, roll or tuck the half of the diaper closest to the mattress tightly underneath the patient's hip and back. Upon completion of the procedure, properly position the patient's gown and immediately pull up the clean bed linens to maintain thermal comfort and personal dignity. Before departing the patient's room, ensure the bed frame is fully lowered to the safest level and corresponding side rails are locked in accordance with the patient's care plan. The call light must be positioned within immediate reach, and a final assessment of patient needs must be conducted. Lastly, relocate the bedside table adjacent to the bed to facilitate effortless access to personal items. Thank you for watching. I appreciate your time and attention.